Hi, I'm Dr. Tanveer Janjua. I'm a board-certified facial plastic surgeon. Today we'll demonstrate the repair of nasal valve collapse. It is a very common entity that contributes to nasal obstruction in a lot of patients, and it can go misdiagnosed or underdiagnosed a lot of times. While obstruction because of nasal deviated septum or large turbinates is very easy to do, it can be difficult at times to diagnose and confirm the obstruction because of nasal valve. However, if it is not diagnosed, then all other treatments will fail to some degree and you will not achieve adequate nasal breathing. And we will demonstrate what happens before surgery in terms of the collapse, the actual procedure, and then we will follow the patient to see how the collapse responds to the repair. So at this point we would like to demonstrate the nasal valve collapse, and our patient is very kind. She has allowed us to videotape it, and we will use it for educational purposes. And the very first thing I usually do is I ask the patient to take a gentle breath. Could you please take just a gentle breath through your nose? Great. Now I'm going to have the patient take a deep breath with force. Great. So now you can see the collapse happening on the deep breath. I'm going to occlude the side which is good, which is the right side, gently, and now I'm going to have her take a deeper breath again. Deep breath, please. You can even hear the obstruction, and now I will use a Q-tip, and with that we'll be able to eliminate that problem. This is called the cartel maneuver, where we can pull the cheek to the side. I want you to take a deep breath. How's that?
Better.
Great. So that immediately tells us that the valve is an issue. Or we can use the Q-tip test where we go inside and we push the area of maximal collapse outwards. So this is the area of maximal collapse. We just gently push it, keep it there. Take a deep breath, please. As you can see, that was a very good breath. So we already know the area of maximal collapse right here. And if we can support it with appropriate amount of cartilage, we can eliminate or at least reduce the problem. We'll zoom in a little now to get a better look on the nose, and we'll do the same maneuvers again. Could you take a deep breath, please? Excellent. We will change our vantage point for a better view. So I'm going to have you take a deep breath again, please, so you can see the amount of collapse. Let's take a deep breath, please. I am going to mark the area of maximal collapse because that will show us where we need to place our graft for maximal result. Take a deep breath, please. Take a deep breath, please. Wonderful. So this is the area of the scroll, and the scroll area is where the upper lateral cartilage meets the lower lateral cartilage, and it can be deficient at times. And if you were to compare both sides, you can tell that this area has a little bit more cartilage support as opposed to the left side. And this is what we will fix. And for one last time, I'll ask you to please take a deep breath. Excellent. Great. We have marked the patient in the area of maximal collapse in the left nasal valve. Would you take a deep breath for me, please? Thank you. Take a deep breath, please. Again. Thank you. So at this point we have harvested the cartilage, and the cartilage is covering the defect. As you can see, that's the defect that was marked, and the cartilage will cover. It extends a little bit further than the defect for more anchoring along the lateral aspect. So the cartilage is going to cover the defect and avoid the nasal collapse. We are with our patient today 3 weeks after her surgery to repair the nasal valve. We repaired the left nasal valve by creating a pocket underneath the area of the most retraction on deep inspiratory breath. And we placed the cartilage from the nasal septum in that area, and now that is supporting the weak part and it does not collapse anymore. So we will have our patient take a deep breath and see how it feels. Could you please take a deep breath through your nose? Good. So there's no collapse as we can see. Now we will occlude the right passage and have her take a deep breath, please. And as you can see, there is no obstruction whatsoever. On examination in the inside, it looks very good, and we have resolved the nasal valve issue.